More Lifestyle segment is sponsored by Nevro Corporation.
With diabetes, some people may experience painful diabetic neuropathy or PDN symptoms. To tell us more about PDN and a new treatment available is Professor of Neurosurgery Dr. Erika Petersen and Type 1 diabetes patient Lee Cagle. Welcome to the show, you guys.
Thank you so much.
All right, so let's start off with Dr. Petersen. Dr. Petersen, can you tell us more about this condition and the struggles it brings to people suffering from it?
It's a side effect or complication of diabetes where the high blood sugar levels ultimately cause tissue damage, and that includes nerve damage. And with that nerve damage, there's pain, there's numbness, it can be burning, it can be itching or pins and needles. It's a sensitivity just to light touch, which means people don't want to wear shoes. It's painful to walk on a floor with bare feet. Even the sheet brushing over their feet at night can be painful. And there's not a lot of really good medications that work in the long term because there can be a lot of side effects, or they may just stop working over time. So we were looking for non-drug ways to try to help this sort of severe pain.
Okay, so tell me about the new treatment. What is it?
Yeah, so HFX for PDN is, think about it like a pacemaker for pain. It's a little implanted device. It's got a battery pack that goes underneath the skin, and then there's wires that travel from that into the spinal canal, and it provides impulses into the spinal nerves. And those impulses are designed to block the pain sensations, the I'm damaged, I hurt message that is traveling from the feet up to the brain to give people some peace and quiet and better comfort in their own bodies.
Oh, wow. Okay, now, Lee, can you tell me how some of the symptoms of PDN impacted your life?
I became very miserable mentally. I was irritable at work. No one wanted to be around me. Out of work, as soon as I got home, all I wanted to do was prop my feet up and get off my feet. And then it's the lack of wanting to do anything. It makes you very unpleasant to be around, and I lost like some of my friendships and everything that I had.
Wow.
People I work around didn't want to hang out with me after work. It was a terrible experience.
Oh my goodness. So how has this new treatment changed your life since then?
I'm able to go out and hike and fish again. I'm able to get off work after a 10-12 hour day on my feet and go home and mow. And there's like hardly any pain at all now.
How can people learn more about this?
HFXforPDN.com, and there's a questionnaire there. The device is FDA approved. Doctors who are experts in spinal cord stimulation, particularly with the HFX device, would be the ones that would do the implant and finally decide if a person qualifies and should have the procedure or not.
Wow. Well, thank you, Dr. Petersen, for talking to us about this. And thank you, Lee, for telling us your story.
Thank you so much for having us.